I couldn't find my hoodie. I really want to study in my hoodie, but apparently I won't be studying in the hoodie. I really prefer to take practice tests versus listening to lectures all day because my attention span ain't what it should be. But hey.
Before we get to insomnia, let's first briefly cover the types of sleep. Diagnosis course. Before we get started, I did want to give you a little heads
And
up
I
that
am
in
using
this
Sarah
video
Michelle
section,
right now,
we
but I'm
will
gonna go
briefly be
between
discussing
Latrina
specific
Walden.
topics like
I'll do Latrina Walden, Sarah Michelle. I don't know who's best. I just need to know this information before I go and sit for this exam.
and trauma that could potentially be discussing. So totally feel free to sit this one out if you need to. In this video, we will discuss the two most common mental health conditions that you are likely to manage in primary care, and those conditions are depression and anxiety. Now, not only does depression affect mood, but it can also impact self-care and general physical functioning and exacerbate other chronic medical conditions. While depression can be successfully treated, many patients unfortunately go undiagnosed, in part attributed to the associated stigma surrounding this diagnosis. As clinicians, it is our responsibility to assess our patients for depression with an unbiased approach and connect them with the necessary care. This should be the case for any psych or mental health condition. Let me be clear that absolutely anyone can develop depression. So that includes children, adolescents, adults, and there are some risk factors that can put you at a higher risk. And some examples of those include a family history of depression, major negative life events, or the presence of other chronic conditions like cancer or Parkinson's disease. Now, while there are many types of depression, we are going to focus on MDD, which is major depressive disorder. The symptoms of major depressive disorder can vary between patients, but for diagnosis, according to the 5th edition text revision of that Diagnostic and Statistical Manual of Mental Disorders, the DSM-5-TR, one of two key symptoms must be present here: a sad, depressed mood, or the loss of pleasure or interest in activities that the patient once enjoyed. To remember the common symptoms of MDD, you can think about this mnemonic of SITCHCAPS, which stands for sleep disturbances, decreased interest, guilt, decreased energy, decreased concentration, appetite changes, psychomotor symptoms, and suicidal ideation. To meet the criteria for MDD, the patient's symptoms must have been present for at least 2 consecutive weeks and interfere with their daily living. This right here is a really great screening tool for depression, and it is called the 2-item patient health questionnaire, commonly known as PHQ-2. It involves only 2 questions and asks about the 2 main symptoms of depression: anhedonia and a sad, depressed mood over the past 2 weeks. If a patient has a positive result on this PHQ-2 with a score of 3 or higher, we ask them to complete the full PHQ-9. Now, this PHQ-9 is going to ask additional questions about other symptoms such as sleep disturbances, appetite changes, and concentration issues. A score of 5 or greater on the PHQ-9 suggests a diagnosis of depression. However, it is always important to note that we need to look at the entire clinical picture, and we need to rule out any other diagnoses, both psych-related and not, that could possibly cause depressive symptoms. If a patient is experiencing symptoms of depression, we absolutely need to assess for any thoughts of self-harm or harm to someone else. We need to be very direct, and we need to ask the patient, have you had any thoughts of harming yourself or others? If that answer is yes, then we need to investigate to see if they have a plan. If the patient does have a detailed plan with the current means to be able to carry it out, we absolutely need to have them transported to the emergency department for further evaluation and management. There are several risk factors that increase one's risk for suicide, ranging from individual to societal levels. And some individual examples include being of the male sex, a history of underlying psych disorders, including depression and substance use disorders, and chronic pain or other chronic comorbidities that carry a significant burden. Older adults also have a higher rate of suicide compared to other age groups as well. The goal of treatment for depression is the remission of symptoms. Treatment options depend on the severity of the patient's symptoms, but generally speaking, a combination of pharmacological management and psychotherapy is going to be most effective, especially for those experiencing those more severe symptoms. Cognitive behavioral therapy is usually the go-to type of psychotherapy. First-line medication classes for major depressive disorder are selective serotonin reuptake inhibitors and those serotonin norepinephrine reuptake inhibitors, so the SSRIs and the SNRIs. With all medications, we want to start at a lower dose, taper up slowly, and anytime we start one of these medications, remember that there is that potential for an increased risk for suicidal ideation, especially in our younger adults. And so we need to educate our patients about that and what to do if it happens. Patients will start to see the true effects of these medications about 4 to 6 weeks after taking it consecutively. While we can certainly treat depression in a primary care setting, we also need to recognize when that referral is needed. Indications for referral include the need for multiple medications, if they have suboptimal control of symptoms despite recommended treatment, changes in symptoms suggestive of a different underlying mental health condition, and a coexisting substance use disorder. Before we move on, let's go over another type of depressive disorder, which is seasonal affective disorder. This is when a person experiences depression routinely at the same time every year, most commonly in the winter. And this occurs because the changing of the seasons affects the patient's circadian rhythm. While you can use medications and psychotherapy, what is a unique treatment specifically for seasonal affective disorder? That's going to be light therapy, which helps to reset that circadian rhythm. Let's switch gears a little bit and now talk about generalized anxiety disorder. Now keep in mind that anxiety is a perfectly normal reaction to the fight or flight response that occurs in certain situations. Anxiety can be acute, but more often is chronic, and it's a lifelong condition. And as that anxiety progresses, it can lead to intense worry and fear and cause physical symptoms. It is key to remember that anxiety and depression often coexist, and so there may be overlapping of symptoms. According to that DSM-5-TR criteria for generalized anxiety disorder, the anxiety must have occurred on more days than not for at least 6 months. The anxiety must be excessive in nature, difficult to control, cause impairment in functioning, and not be caused by other substance or mental health disorders. A great mnemonic here to help you remember the main symptoms of generalized anxiety disorder is WATCHERS, which stands for worry, anxiety, tension, concentration difficulty, hyperarousal, energy loss, restlessness, and sleep disturbance. The Generalized Anxiety Disorder 2-item scale, or the GAD-2, is a quick 2-question screening tool. It asks the patient if they have felt nervous, anxious, or on edge, and how often they were not able to stop or control the worrying over the last 2 weeks. A total score of 3 or greater would warrant further follow-up with the GAD-7. The GAD-7 has a total of 7 questions that evaluate for the frequency of other anxiety symptoms over those past 2 weeks, such as restlessness or irritability, and a score of 5 or higher suggests a possible generalized anxiety disorder diagnosis and therefore would warrant further evaluation as well. Both pharmacological therapy and psychotherapy, typically that CBT, are effective for generalized anxiety disorder and can be used alone or in combination depending on the patient's individual clinical picture here. Just like for depression, SSRIs and SNRIs are first-line drug classes for this disorder. As always, we can always consult a specialist for any persistent symptoms or changes in symptoms that suggest another psychiatric mental health disorder. And that wraps up this video, my friend.
Okay. I didn't say that. I don't know what I was doing. Oh, crap. I do know what I'm doing.
Setting, which in this video, we are going to cover a few other mental health conditions you may see in the primary care setting, which are insomnia, bipolar disorder, and post-traumatic stress disorder. Before we get to insomnia, let's first briefly cover the types of sleep that normally occur. We are talking about the non-rapid eye movement and rapid eye movement sleep states. During non-rapid eye movement sleep, the body relaxes and physiological functions slow. However, during REM sleep, physiological activity, including brain function, is very similar to when someone is awake. REM sleep is important because this is when the brain has a chance to process information. Both non-REM and REM sleep combine to provide restorative benefits for our bodies and our minds. When a person experiences disruptions in their sleep cycle, they can develop a wide array of symptoms like mood changes, cognitive issues, and fatigue. Simply put, insomnia is characterized by difficulty falling asleep, difficulty staying asleep, or both. And the sleep difficulties lead to daytime sleepiness and impairment. Short-term insomnia lasts less than 3 months and usually has an identifiable trigger, typically some sort of major life event. For a patient to be diagnosed with chronic insomnia, sleep disturbances have to have occurred for at least 3 nights a week for 3 months. While the insomnia diagnostic criteria is pretty straightforward, a lot of factors can play into a patient developing sleep issues. As primary care clinicians, our role often involves diving into their medical history to identify what might be preventing a patient from having a restful night of sleep. Many medications and substances, such as glucocorticoids or caffeine, can exacerbate sleep disturbances. It's also common for patients to experience sleep disturbances with other psychiatric mental health conditions like anxiety or depression, and a wide array of other chronic conditions like COPD or Parkinson's disease. The initial management of insomnia involves patient education about proper sleep hygiene. We should advise patients to limit caffeine, especially later in the day, avoid screen use around bedtime, and maintain a consistent sleep-wake schedule every day. Cognitive behavioral therapy is considered to be the first-line management of insomnia, as it is well supported in the literature. If this provides suboptimal relief, some patients prefer to use supplements like melatonin or over-the-counter sleep aids like Benadryl. If insomnia symptoms are persistent, there are several prescription drug classes available. However, these do not come without risks, as most of them have a laundry list of serious side effects that are especially exacerbated in our older adult population. A commonly used FDA-approved drug class for insomnia is the non-benzodiazepine receptor agonist class, which includes drugs like Ambien and Lunesta. These may help patients both fall asleep and stay asleep. While these are effective and carry a lower risk of dependence than traditional benzodiazepines, they can cause CNS depression, psychiatric side effects, and carry a box warning for complex sleep behaviors like sleepwalking and sleep driving. Overall, the approach to treating insomnia is multifaceted, individualized, and may even require a referral to a sleep specialist. Let's shift gears to bipolar disorder, which is a condition characterized by extreme mood episodes. Bipolar disorder may involve episodes of mania, which is characterized by extreme excitement and happiness, frenzied speech or flight of ideas, racing thoughts, decreased need for sleep, impulsivity, and poor judgment. It may also involve episodes of hypomania, or a less extreme version of mania that lasts for a shorter period of time, and episodes of depression. While we won't be diagnosing this in primary care, the key here is that there are two main categories, bipolar 1 and bipolar 2, and the episodes of mania occur only in bipolar 1. While bipolar disorder is typically managed by a specialist, it is crucial for primary care clinicians to be able to identify it as a possible diagnosis because it requires mood stabilizing medications like lithium, and symptoms may actually worsen with standard antidepressants. Lastly, let's briefly discuss post traumatic stress disorder, or PTSD, which occurs in response to a traumatic event or experience. The trauma can be physical or emotional, including sexual violence, experiencing the death or loss of someone, and being a victim of a crime. PTSD is an incredibly complex diagnosis characterized by intrusive nightmares and severe flashbacks of the traumatic event, changes in behavior to avoid things associated with that traumatic event, hypervigilance, and changes in mood and reactivity. PTSD should be diagnosed and managed by specialists, as it can commonly occur alongside other psych mental health conditions like depression or substance use disorders. PTSD treatment is very dependent on the individual patient's clinical picture, but typically involves medications like SSRIs and psychotherapy. And that completes this video.
Do I want to go ahead and pay $50 for a practice test? I mean, maybe. IBEA predictor test. That. I know all those answers. Need to. I don't know if APEA was particularly helpful. Let's see if I can log into my. We don't have any exams assigned to this time at this time. Anyway, it was so different. So $60 for the APEA predictor exam. $50 on the AANP website for a practice test. I don't know if I like APEA. Excuse me. $490 for the bundle. Let's say no. Um, where are my practice questions then? How do I accumulate it? I think I like memorize all these answers. So maybe I should try to lead. At this point, I don't want to do any of these. Let me. Access to my leak prep because I'm not about to pay $500 for anything. I've already paid for prep. So for exam prep, so I'm not gonna pay again for APEA. But let's see. These exams were freaking long. Practice. What did I just do? Psych. Let's do psych, bro. Man. Diagnostic criteria. I questions until I can't question anymore. Right now, rationales, because I just don't have the attention span anymore to listen to lectures. What are the diagnostic criteria for major depressive disorder? Depressed mood or loss of interest or pleasure in nearly all activities, as well as at least 5 or 9 additional symptoms for at least 2 weeks. Presence of delusions, no history of at least one manic episode. Mania is with bipolar disorder. Presence of at least one episode of hypomania. No, I'm gonna go away. Yes. So a depressed mood or loss of interest or pleasure in nearly all activities, as well as at least 5 of 9 additional symptoms for at least 2 weeks. The diagnostic criteria for major depressive disorder include a depressed mood or loss of interest or pleasure in nearly all activities, as well as at least 5 of 9 additional symptoms. So there are 9 symptoms for depression. But I know, so the main thing is to know that the depressed mood needs to have lasted for 2 weeks, at least 2 weeks. History of at least one manic episode with or without a history of major depressive episodes is the diagnostic criterion for bipolar disorder. But that's bipolar 1. There isn't any mania in bipolar 2. Presence of at least one episode of hypomania. and at least one episode of major depression are the diagnostic criteria for bipolar 2 disorder. Let's write that. Presence of at least one episode of hypomania, one episode of what? So just mean you don't want to do anything? Is this depression? What? And major depression is for bipolar 2 disorder. An adolescent patient presents with symptoms of persistent worry, restlessness, difficulty concentrating, and muscle tension. So let's look at it. They're restless, won't be their ass still. Difficulty concentrating and muscle tension. The patient reports experiencing these symptoms for at least 6 months. Based on the patient's reported symptoms, which screening tests would the nurse practitioner most likely conduct to assess for a specific mental health disorder? It says the PHQ, the GAD-7, the MDQ, or the Y box. I'm going to go with the GAD because it sounds like the patient has anxiety. So the patient's symptoms of persistent worry, restlessness, difficulty concentrating, and muscle tension for at least 6 months are suggestive of general anxiety disorder. To assess for general anxiety disorder or GAD, the nurse practitioner would most likely conduct the GAD-7 screening test. The GAD-7 is a brief self-report questionnaire that assesses the severity of anxiety symptoms over the past 2 weeks. It is a reliable tool for identifying and measuring the presence of GAD. The PHQ-9 is used to screen for depression, not GAD. The MDQ, which is the mood disorder questionnaire, is used for screening for bipolar disorder, which involves distinct periods of mania and depression. The Y box is specific to assessing OCD. So the MDQ is for bipolar. Mm-hmm. Make a little note of that. I mean, it's mood disorder. I felt I would know that on the test. Which statement about nicotine gum is true? The patient chews each piece continuously until the nicotine is depleted. The gum is most effective when used to supplement the nicotine patch. Patients with depressive symptoms should avoid the product. Users will likely require several pieces a day. So for this one, users will likely require several pieces a day. Nicotine gum aids in smoking cessation by providing an alternative source of nicotine. Each piece provides nicotine for approximately 30 minutes. Okay, that's good to know. Oh, crap. For about 30 minutes, and users will likely require several pieces each day. Okay. So they'll need several pieces each day early in their cessation effort. The patient chews each piece briefly to release the nicotine, but then parts the gum next to the buccal mucosa until it is depleted. So you chew it for a little bit and then put it in your cheek. Okay. To avoid the risk of nicotine overdose, patients should be cautioned against combining nicotine gum with other sources of nicotine, such as the patch. Patients with depressive symptoms or recent suicidal thoughts should avoid some medications used in cessation, specifically bupropion and valerinesin, but no such caution exists for nicotine gum. I need more details about this. Am I gonna be able Cause don't tell me that. I know that. I don't think. What is that? Wellbutrin? Hmm. Okay, so you don't want patients with depressive symptoms or recent suicidal thoughts should avoid some medications in cessation, specifically Wellbutrin, but not for the gum. So what do they talk about? Chantix? Okay. So Chantix and Wellbutrin? I don't. So if patient has a history of depression or suicidal thoughts during cessation, they should avoid Chantix. That's a dumbass way to put it. I don't know what you're talking about. Which class of medication is commonly used as first line treatment for ADHD? Stimulants. Oh crap! What happened? Stimulant medications such as amphetamines are commonly used as first line treatment for ADHD. They help improve focus, attention, and impulse control. Mhm. Next, a 65-year-old patient presents with memory loss, confusion, and difficulty with language. Based on the patient's symptoms, which screening tool should be used for cognitive assessment? We are going to go with the mini mental state examination. The patient's symptoms of memory loss, confusion, and difficulty with language suggest the presence of cognitive impairment. The most appropriate screening tool for cognitive assessment is the MMSE, which is the mini mental state examination. The MMSE is widely used and evaluates various cognitive domains, including orientation, memory, attention, language, and visual spatial skills. It's commonly employed for diagnosing and monitoring cognitive impairment related to conditions such as Alzheimer's disease. Okay, very good. A 25-year-old male patient presents with a history of schizophrenia and currently taking risperidone. Ooh. He reports improvement in his symptoms, but complains of weight gain and decreased motivation. On examination, on examination, he has a BMI of 32 and reports feeling apathetic, which is the most appropriate next step in management. Discontinue the risperidone. So you got discontinue risperidone and initiate Riprazole, and then discontinue risperidone and initiate clozapine, and then continue risperidone and initiate metformin for weight loss, or you can continue the risperidone, initiate Wellbutrin for motivation. We are going to discontinue the risperidone and initiate the Riprazole. So with the age of the patient, This can impact the antipsychotic medication, with older patients generally being more susceptible to metabolic side effects such as weight gain and diabetes. So this patient is young. In this case, the patient is a 25-year-old man with a history of schizophrenia who is currently taking risperidone. Although he reports improvement in his symptoms, he is experiencing weight gain and decreased motivation, which are common side effects of atypical antipsychotic medications and can lead to poor adherence and other negative outcomes. Given the patient's age and desire to balance effective treatment with minimizing side effects, the most appropriate next step in management would be to discontinue the risperidone and initiate a second generation antipsychotic. Um, okay, so no risperidone, but we can try Abilify. Okay, okay. So let's do risperidone. Risperidone. Whatever. Oh, crap. Risperidone first. So both are atypical psychotics. That's a lie. It's not inactivity. No one's talking to me. I'm steady. What do they want from me? Literally talking into the screen. What? I guess they. Um. Let me charge my iPad. That's so better. But it's the device of nothing. So anyway, aripiprazole, and risperidone are both atypical psychotics used to treat various mental health conditions, but they differ in their side effects, uses, and overall profiles. So Abilify primarily used for schizophrenia, bipolar disorder, and as an adjunct treatment for major depressive disorder. It is also approved for Tourette syndrome and irritability associated with autism. Risperidone is also used because it's the same thing. Uh, so risperidone is more likely to cause sedation, weight gain, hyperprolactinemia, which can lead to sexual dysfunction. Abilify generally has a lower risk of weight gain, so that's why you switch them. Okay, we just write risperidone, increase weight. No one wants to gain weight if they're not trying to. And then aripiprazole, we have lower risk of weight gain. Okay, thank you. An older adult male with alcohol use disorder is scheduled for a physical exam and laboratory testing. The patient's laboratory blood test results may show increased serum creatinine levels and EGFR rate, increased glomerular filtration rate, and increased serum creatinine, creatinine, creatine. I shouldn't have had caffeine today. Creatinine. Decreased number of platelets and increased mean corpuscular volume. Increased serum potassium and increased triglycerides. Decreased AST and decreased AST and ALT. Okay. Why is it? I don't like it when it does that. So the patient will have a decreased number of platelets and increased MCV. Chronic alcohol use commonly results in macrocytosis, which is an increased MCV due to folate deficiency and thrombocytopenia due to bone marrow suppression and impaired platelet production. These effects make option B correct. While alcohol can alter lipid metabolism because it affects the liver and leads to hypertriglyceridemia, option C is incorrect because increased serum potassium is not a typical finding in alcohol use disorder. Chronic alcohol. A patient presents to the clinic with notable weight loss, low energy, and paler. Their body mass index is 16.2. On laboratory investigation, blood tests reveal anemia, hypokalemia, and elevated liver enzymes. The patient notes and adherence to a restrictive diet to ensure weight loss. What diagnosis allows these symptoms, signs, and laboratory findings? Do you have anorexia? What? Why are they doing that? So yes, patient is anorexic. Which of the following is part of the female athlete triad? Lanugo, premature osteoporosis, self-absorbed behavior, insulin resistance. What? I would have liked which is not. Oh, those are wrong. Never mind. Why is it? So A, lanugo, B, premature osteoporosis, C, self-absorbed behavior, insulin resistance. And they want to know which one is a part of it. Lanugo is common when patients are anorexic. What you doing with that baby hair on you? You need to eat. The female athlete triad consists of amenorrhea, premature osteopenia or osteoporosis, and disordered eating. Lanugo and self-absorbed behavior is seen with anorexia nervosa, but they are not part of the triad. And insulin resistance is part of metabolic syndrome. Which of the following individuals is at higher risk for suicide? White female teenager who fails an exam, black middle-aged female who is newly diagnosed with type 2 diabetes, older white male whose spouse of 40 years just died. That's the one. I don't have to read D. A 24-year-old patient presents with a 2-day history of high fever, um, with high fever, two-day history of high fever, muscle stiffness, and confusion. They were recently diagnosed with schizophrenia and started taking oral meds 1 week ago. It's haloperidol, but the caffeine has made me stutter today. Laboratory tests show an increased creatinine kinase level. What is the nurse practitioner's primary diagnosis? Let's see. Malignant neuroleptic syndrome. This is a rare but life-threatening reaction to an antipsychotic drug. It may occur when a patient is newly exposed. Oh, I gotta use it. To a drug or has recently had a dose increase. Start slow. Start low and go slow. Hyperthermia, muscle rigidity. So lead pipe rigidity is common. Altered mental status like confusion, autonomic dysregulation, increased creatinine kinase level is also common finding due to rhabdomyolysis from sustained muscle rigidity. And that's a pretty easy one to answer. Which of the following medications is most likely to cause erectile dysfunction? We're going to go with paroxetine because paroxetine is most likely to cause erectile dysfunction. It can also affect female orgasm. So when you give paroxetine, give a little Wellbutrin to counteract with those sexual side effects with the medication. Yeah, those SSRIs have sexual side effects. Give Wellbutrin to counteract with them. An older adult female patient with peripheral neuropathy due to diabetes mellitus is recently diagnosed with major depression. The patient refuses psychotherapy and wants medication. She denies suicidal and homicidal ideation. Which of the following pharmacologic agents is best choice for this patient? Everybody on this. Ooh. We're going to start with some Cymbalta, duloxetine, which is an SNRI, I'm sorry, that is used for depression, chronic anxiety, and the management of neuropathy. So we could have, okay, so that would have been a question that you can get stuck between because you had Lexapro, which is a SSRI, and you had the SNRI. But if the patient only had major depression, you could probably do just the SSRI. You could do the SSRI. But because she has diabetes and is complaining about peripheral neuropathy, then you want to use the SNRI because it can treat that as well. That I don't know. I chose the right answer, but I just went with my first mind. Duloxetine is about neuropathy. So neuropathy first and depression. Okay, next. A patient with depression is taking Celexa daily. They inform the nurse practitioner that they recently started taking St. John's wort as a supplement to improve their depression. What recommendation is most important? Is most appropriate? They need to stop taking that St. John's wort. Concurrent use of St. John's warts with a SSRI can result in drug interactions, reduce the effectiveness of medication. So avoid St. John's wort when you are taking SSRIs, such as Celexa. Mm. Just let me take it on. A male patient history indicates that they are prescribed Nardil for depression and anxiety. What information revealed during the patient interview would be the most urgent for the nurse practitioner to address with the patient? The patient drinks 1 to 2 beers per week. Patients who are prescribed a MAOI, such as Nardil, should be advised to avoid alcohol because it contains tyramine. The consumption of tyramine that could put you into like a hypertensive crisis. The consumption of tyramine while taking an MAOI can result in severely elevated blood pressure and increased risk for stroke. I don't even think you can have guacamole while you're on the MAOI. While the nurse practitioner should discuss smoking cessation, this is less urgent when explaining the dangerous food-drug interaction. Insomnia and anorexia are common side effects of SSRI, but reports of occasional difficulty sleeping and recent poor appetite do not suggest any imminent risk for the patient. That is correct. A patient presents to the clinic with complaints of frequent sore throats and dental erosion. When discussing dietary history, they become visibly anxious and acknowledge sometimes consuming large meals late at night. The patient's BMI is 22, that's low. Which diagnostic step would be the most appropriate for the patient? Sounds like this patient is bulimic. Order the order of throat culture to determine the cause of frequent sore throats. That's that acid tearing that throat up. Ask about possible episodes of compensatory behavior such as vomiting or excessive exercise. I need to know. Yeah. Frequent sore throats, dental erosions, acid, anxiety around discussing diet, periods of consuming large meals suggested possible diagnosis of bulimia nervosa. However, diagnosis also requires evidence of compensatory behaviors to prevent weight gain. So you got to ask about behaviors. A 75-year-old patient presents with their live-in caregiver for a routine checkup. During the visit, the patient mentions struggles with affording their medications and rent. The nurse practitioner notes that some discrepancies between the patient's account of their financial situation and the spending habits described by the caregiver. Which of the following would be the most appropriate initial action? Uh-uh. We need to speak privately with the patient about the situation and offering information on resources for financial abuse. It's important to respect patient autonomy and maintain confidentiality, especially in potentially sensitive situations like suspected abuse. Speaking privately without the caregiver present provides a safe space for the patient to discuss their experiences. So they can speak with social services, adult protective services, or legal aid services. We can't go straight to report to law enforcement, calling the police on people. A patient reports concern about the amount of alcohol they consume. Which screening tool should the nurse practitioner consider administering? The audit, the alcohol use disorder identification test. I'm going to audit you. A 19-year-old patient is referred to the nurse practitioner by a counselor after disclosing symptoms consistent with bulimia nervosa, including frequent episodes of binge eating followed by self-induced vomiting. The patient expresses distress over their eating behavior and desire for help and a desire for help. The physical exam is unremarkable, and their lab tests, including electrolytes, are within normal limits. What is the most appropriate? Show my face every now and then. What is the most appropriate initial treatment for this patients? Can we do some cognitive behavioral therapy? Yeah. Bulimia requires a multifaceted approach, focusing on psychological, nutritional, and medical aspects. Among these, the psychological aspect is often addressed initially and referred for specialized CBT, and a referral for specialized CBT is considered the first line treatment. SSRIs may be part of the treatment plan. However, SSRIs alone are not the initial treatment of choice. I feel like SSRIs is the um SSRI. Give them an SSRI. Ooh, that hurt my elbow. The nurse practitioner is conducting a MMSE on a patient. Which result indicates impairment. A score of 20. The MMSE is used to evaluate an individual for confusion and dementia. A maximum of 30 points are assigned. Okay. The nurse practitioner has finished conducting the cage questionnaire with a patient. The patient responded yes when they asked if they felt the need to cut down their drinking and if they felt guilty about their drinking. The patient responded no to the other two questions. What's the appropriate next step? We need to discuss the possibility of alcohol misuse with the patient. You feel guilty. You don't feel guilty about your drinking, but you know you need to cut down. It's only 4 questions. Do you have an eye opener? If you have an eye opener, it's time. If you have a drink as soon as you wake up in the morning, it's time to cut down. You should not be drinking unless you're on vacation. Not vacation ain't every day, but if you have to have an eye opener, that's what it's called, an eye opener. If you're having an eye opener, it's safe to say you're alcoholic. It's safe to say you're an alcoholic. I have an eye opener on vacation though. Is that bad? It's vacation. An adult patient arrives in the clinic for a routine physical examination. They complain of frequent morning headaches and feeling increasingly fatigued over the past few months. The patient's spouse, who accompanies them, at 2:30. An adult patient arrives in the clinic for a routine physical examination. They complain of frequent morning headaches and feeling increasingly fatigued over the past few months. The patient's spouse who accompanies them expresses concern about the patient's increase in alcohol consumption over the last year, stating that the patient often drinks to get through the day. Which of the following would be the most appropriate next step in assessing this patient? Let's administer the cage questionnaire. I need to know. Does the patient think they have a problem? Yeah. I'm not crocheting. Reset. I'm steady. But don't forget to get your daily at the top and tap the screen a few times. Thank you. Yeah, I'm not crocheting anything. A patient who's been prescribed Lamictal for bipolar disorder calls the clinic for to report a rash. Which syndrome does the nurse practitioner expect? They have a rash from Lamictal. They may have Stevens Johnson. Yeah. Stevens Johnson syndrome, a rare but serious disorder that appears as a skin rash, is a potential adverse effect of Lamictal, an anticonvulsant sometimes prescribed for treatment of bipolar disorder. Can I even type that in the chat? Cannot. Let me see if I can do it like this. Let me see if it's going to let me. No, that's something. Oh, I gotta pause it because I gotta pause an MP. I've been holding it. Oh, again. No. Straight. What's the restroom? A little tasty. Oh, God. I have to change my headphones. It was bothering me. That feels better. Left, right, left, right. Let's get comfortable. Do I want a sausage? That's gonna blow me for like 2 weeks if I get a sausage. I want to look like Pharaoh. Okay, so Steven Johnson syndrome. Let me type this into the chat. I think that would be very redundant. Yeah, Steve. A potential, I need to be saying this out loud. This is a potential adverse effect of Peaches, there you go. Peaches. Hey girl, hey. My lips a little dry. Let me say hey. Hey Peaches. I'm on YouTube as well. I am on YouTube as well. Let me see. Oh, let me see. And I know I got head scars, but my hair is actually there's nothing wrong with my hair. I just don't want to show my hair. Why? Why am I this way? I couldn't tell you. Okay, be quiet. Be quiet. I'm sorry. Okay. It's a potential side effect of substance described What is this for? Did you know? Oh, some medical emergency. That's good to know. Peaches, oh, you tapping, girl. Tap, tap, tap in. This is a medical emergency. Okay, next, Lamictal. That is an anticonvulsant. Which of the following best support diagnosis of a factitious disorder imposed on self? Factitious? Okay, girl, I'll be here for a while. Um, this is factitious. Um, falsifying symptoms to obtain medical treatment. Why is it doing that? Which of the following best supports? You know what? I just put all this shit up. I mean, I'll write some of it if I need it, but I just cannot. I have to figure out how I want to fit it in. This, you can see it. You can see. Can you see my hand? You're not gonna be able to see. Oh, wait, there we go. Doing this. Yeah. No, about that. I got to answer for this and stuff. $50 for practices. Mm, mm, crazy. Which of the following best support a diagnosis of factitious disorder imposed on self? Falsifying symptoms to obtain medical treatment. Factitious disorder imposed on self or Munchausen Munchausen syndrome involves the patient falsifying symptoms of a disorder or inflicting self-harm to obtain medical care while reporting symptoms that the provider cannot definitively link to a health disorder. Why are you lying? I remember that though. Who mama had Munchausen? Eminem. So Eminem's mom had factitious disorder. Well, he said that. Factitious disorder imposed on self. Body exposure and sexual behavior. When? TikTok? Whatever. Munchausen by proxy. A patient diagnosed with insomnia has expressed a preference for alternative treatment instead of medication. What option should the nurse practitioner suggest? Ugh. We would suggest melatonin. Kava kava is Okay, let's put that. It's associated. That's so loud. It's associated with the injury.
That was like that it's I can live every day now. It's like I get $19. When you become a senior partner, it's more than this. They have been so $19. This is this St. Jude t-shirt you can proudly wear to show your son. All these children deserve to wear, and I would love for it to be the day where no one take a party. Severe losing our child and people deserve. Give it us. Make your donation now. I will save and save lives.
My battery is running low. Don't say. Well, I have a charger to. That's not bad. I'm gonna put it right here. I do like it right there. Thank you. Okay. Yeah. I'm not talking about no Stephen Johnson syndrome, but anyway, if a patient has insomnia and has expressed preference for alternative treatment instead of medication, suggest melatonin. Alternative treatment. Insomnia. Melatonin. A patient comes. A patient comes complaining of continuous lower back pain following a construction accident 6 months ago. The patient was initially so it's necessary. The patient was initially prescribed opioids to manage the pain. However, they report needing to take larger doses to achieve the same level of pain relief and feeling very anxious and uncomfortable. If they do not take the medication, given these symptoms, which key signs of opioid use disorder is this patient displaying? Oh my goodness, tolerance and withdrawal symptoms. Tolerance and withdrawal symptoms. The patient's description of needing larger doses of opioids to achieve the same level of pain relief suggests tolerance, a key sign of opioid use disorder. Additionally, the discomfort and anxiety reported by the patient when not taking the medication are indicative of withdrawal syndrome. Hey. Mm. While examining an 80-year-old patient who lives with an adult caregiver, the nurse practitioner observes burn mark on the patient's back. Now you know you need your ass whooped. The patient appears quiet and fearful in the caregiver's presence. What initial action should the nurse practitioner take? Report suspected elder abuse to the appropriate state agency. Ask the caregiver to explain the injuries. Have the caregiver wait in the waiting room. Tell the patient you have some burn like marks on your back. You got to remove that caregiver. In cases of possible abuse, the nurse practitioner should attempt to interview the patient without suspected abuser present. Why do you copy and paste this? Let me try. Mm-mm. I hate that. It's like, mm, what's it on? Oh, yeah. Let me see what happens. Ooh, gotcha. 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 I learned how to copy and paste it. If there's, I'm gonna figure something out. I'm gonna figure it out. I'm gonna figure it out every time. Okay. Which of the following is the principle of motivational interviewing? Why happens we do that? Rolling with the patient's resistance. Motivational interviewing is a counseling technique used to help a patient find their internal motivation to make changes to improve their health. You must express empathy, understanding the patient's motivation, avoiding confrontation, rolling with the resistance, and supporting self efficacy. The nurse practitioner should help the patient identify their own motivation rather than prescribe reasons for changing the behavior. I can do that. I think I'm pretty good with that. I really need to be a psych NP, but that'd be too much on me because I don't know how to turn it off. Although a support network can be helpful, reliance on the network may run counter to the development of self-efficacy. The nurse practitioner should avoid argument or direct confrontation. I'm not even a confrontational person by nature. I avoid conflict really. I like this. I don't think it's too long to put in YouTube, but I'm gonna put it in there. I like this. Mm-mm. Look it up. I think you only have to hit like one time on YouTube. Now I don't think it gives me credit for you hitting it multiple times if you hit that like multiple times. But thank you. I don't know what I'm doing stuff. So the 5 principles of motivational interviewing are expressing empathy, understanding the patient's motivation, avoiding confrontation, rolling with the resistance, and supporting self-efficacy. Is that what it is? Yeah. Okay. So I have to remove this pillow for a little bit. My little scoliosis pillow. I guess we don't need it all the time. Let's just take a break. We've been studying for about say 17 minutes. I know that's a lot. That's a tail. That's a straight up tail. Um, I don't think I downloaded Facebook on me. Okay. The nurse practitioner is seeing a 15-year-old patient who has been showing decline in school performance and social withdrawal. They appear anxious and have lost weight. The patient is vague about their symptoms, but the NP notes pronounce eye redness and behaviors that suggest intoxication. Based on these observations, what would be the most appropriate next step in assessing the patient's condition? Not quite in the US. The question: use a validated adolescent substance use screening such as CROW. Hmm. Uh, is the I think it was snack. I'm tired and I'm kind of hungry. I'm not hungry. Hmm. A 20-year-old patient with co-occurring bulimia nervosa presents to the clinic for treatment of major depressive disorder. Which medication is contraindicated for this patient? I don't think you're supposed to give Wellbutrin to patients with eating disorders. So Wellbutrin is an atypical antidepressant and is contraindicated in patients with anorexia nervosa or bulimia nervosa because it lowers the seizure threshold. It sure does. Lowers that seizure threshold. So yeah. Uh-uh. your business, Charles. A patient who has been dealing with chronic pain for several years due to back injury presents in the clinic. The patient was initially prescribed opioids, and over time, they reported needing to take more to manage their pain. Additionally, they are experiencing restlessness, mood swings, and discomfort when they are trying to reduce their opioid. The patient acknowledges their concern about the increasing reliance on the medication and discussing a treatment plan for the patient. Which of the following options would be the most appropriate first step? They might need some medication assistance. Giving the patient first line treatment, it's an opioid agonist. What is something is acting in my arm? It must be the tide I was using. So I'm so sorry. Like my underarm itch is so bad. Oh my god. What was that? No, it's not a black. It's just itches. Oh, I don't even know how to say. Oh well. Belbuca. I can remember that. It's a sublingual. Buprenex. Oh, okay. So, oh, it would definitely can be no problem with that. It can be a component of the overall treatment, but it's usually not sufficient as a first line treatment, given the patient's physical dependence and the withdrawal symptoms. Sexual side effects resulting from use of SSRIs can be with an adjunctive medication with Wellbutrin. What's it doing? A patient who has been successfully treating depressive symptoms with a prescribed selective serotonin reuptake inhibitor, which is an SSRI, expresses interest in taking omega-3 fatty acids as a complementary therapy. How should a nurse practitioner advise this patient? What? Oh, shoot. So, with omega-3 fatty acids as complementary therapy for the SSRI, you will help the patient identify an appropriate dose. Huh. Oh, it's cool. So, high intake can increase bleeding rates. What did I find this in? Mm. Ooh. So, oh, I don't know that. Omega-3s. Did I know that? Hungry. So, what was that for sight? T. Hurry up. A 22-year-old patient reports alternating episodes of feeling like I can do anything for a few days at a time, but then feeling really down for a couple of weeks after that. The patient further explains that they sleep very little during the positive periods, and it seems like their thoughts are racing during the negative period. They have little energy and difficulty concentrating. Based on this, arrangements of the following would be the most appropriate next step during the visit. Been going on for a while. Man, I forgot one. Mhm. Which of the following smoking cessation options is the most appropriate first line management for a patient with several unsuccessful prior attempts to quit cold turkey? Refers to a smoking cessation support group prescribing nicotine replacement therapy. Let's try some nicotine replacement therapy. It's first line treatment for smoking cessation. Cold turkey is pretty hard. It can help reduce the withdrawal symptoms and cravings. Yeah, so we'll do that. Um, Oh, yeah. Oh, so stupid. A patient accompanied by a family member presents with mental confusion, ataxia, and hypotension. The family member indicates that the patient has a history of alcohol use disorder, which of the following is most likely to be included in the treatment plan. Alcohol, alcohol, alcohol. I'm just gonna go with my first line. Vitamin B1, which is thiamine. The patient's signs and symptoms are consistent with Korsakoff syndrome, which is caused by a chronic deficiency in vitamin B1, which is thiamine, resulting from the chronic use of alcohol. Alcohol, alcohol, alcohol. Immediate treatment involves administration of high dose parenteral, parenter, parenter, vitamins, especially vitamin B, Wellbutrin for depression and smoking cessation. Let's just put that. I like the random facts like this. Alcohol, alcohol, alcohol. Patient presents with and let's continue it by vitamin B1. Wrong. I might replace it. I like doing it like that. Learn with me. Shayla, I'm staying for boards. Girl, I'm just on here. During a routine well child visit, the nurse practitioner notices that a 5-year-old patient has multiple unexplained bruises. Hey, girl. At various stages of healing, inconsistent with typical play-related injuries. The caregiver seems evasive when questioned about the origin of these bruises. Which of the following assessment strategies will be most effective in this situation? No, discreetly arranging for follow-up with no, obtaining a detailed and thorough physical exam with patients 5-year-old. So obtaining a detailed history and thorough physical exam of the patient ensures a comprehensive assessment. In cases of potential child abuse, it is important to obtain as much information as possible. This includes asking about the child's daily routines, whom they live with, any recent injuries or illnesses, any behavior changes. It must be the obvious. A 35-year-old patient reports difficulty falling asleep several nights each week for the past 3 months, often taking 2 to 3 hours to do so. That's a question, right? When they do fall asleep, they wake up several times during the night and have trouble falling back to sleep. In the morning, they often feel that their sleep has been non-restorative and they suffer from daytime fatigue and impaired concentration. Don't forget to get your daily shaver. It's at the top by my name. They deny caffeine, tobacco, or alcohol use. They indicate that they adhere to a consistent bedtime routine and stop television and phone use 60 minutes prior to bedtime. What would be the most appropriate initial treatment plan for this patient? So this patient had like doing everything right. For this patient, we can start cognitive behavior therapy for insomnia. The reported symptoms suggest chronic primary insomnia because it sounds like depression at the beginning, but I guess the way they went into it about consistent bedtime routine, they didn't mention anything about sadness or anything. Okay. Okay. So cognitive behavior therapy for insomnia is first line treatment because they are already doing everything else correctly, I guess. Okay, a 35-year-old female presents to the primary care clinic. She was involved in a severe car crash 4 months ago. She mentions having recurrent nightmares of the event and constantly feeling on edge, PTSD. Recently, she avoids driving or even being a passenger in a car, saying it causes her intense anxiety. She finds herself being easily startled and she has difficulty sleeping. She denies substance use. Which of the following is the most likely diagnosis? Oh, I don't even want to read it. We want to read the rationale. Oh, wait, okay, I guess I got to. PTSD can be diagnosed when a person is exposed to a traumatic event and subsequently experiences symptoms such as intrusive memories of the trauma, avoidance of reminders of the trauma, negative changes in mood or cognition, and marked alterations in arousal and reactivity. These symptoms last for more than a month and cause functional impairment. While acute stress disorder has many of the same symptoms as PTSD, it occurs within 3 days. It resolved within that month. This patient's symptoms have persisted for 4 months. Okay. Which is beyond the time frame for acute stress disorder that disappears in 1 month. Okay. A 16-year-old patient presents with complaints of persistent low mood, lack of interest. Hi, Felicia. Lack of interest in daily activities, decreased appetite, and sleep disturbances for the past 6 months. The patient mentions feeling a sense of hopelessness and has isolated themselves from friends and family. The patient grades have dropped significantly over the last semester. Examination and lab work rule out organic causes and substance use. What is most likely to be included in the initial treatment approach? The patient is 16, so we can do fluoxetine with close monitoring for the first few weeks. But it's gonna take some weeks for it to kick in. What are you doing, Kanisha? The patient symptoms suggest a diagnosis of major depressive disorder in an adolescence, which likely warrants referral for psychotherapy and pharmacological treatment. Fluoxetine and SSRI is approved for the treatment of depression in adolescents and considered first line. That was A. But I knew this one. So funny. Or you can Christmas tree that boo. Hello. Oh crap, I forgot I couldn't do that. You that smooth music in the background. That smooth music in the back. Ooh. Ooh. Mm. Okay. A 45-year-old patient visits the clinic and shares concerns about their smoking habit. They have been smoking a pack of cigarettes a day for the past 20 years. You know what? My hair is actually done. Well, what is it called? My hair is in a ponytail. I don't know what it is. I don't like showing my hair. Maybe I was Muslim in my last life. I don't know. But I don't like showing my hair. Is that strange? And why is this making my ponytail stick up? Oh, because it's cotton and not silk. But I ain't finna put no silk one on. See how you come here playing? See how you come in my room playing? You play too much. You play too much. This ain't time for play. How about you give me some I don't want to show my beautiful hair. We love to see it. Thank you, Felicia. Your hair is beautiful as well. The patient says, I never mean to smoke a whole pack, but sometimes I lose track. Oh my goodness. Girl, you gotta put those cigarettes down. The patient expresses a strong desire to reduce their smoking and indicates that they have failed in 3 previous attempts to quit. How many diagnostic criteria does the patient meet for a diagnosis of tobacco use disorder? Yeah, okay, all of them. Tobacco use disorder is diagnosed based on 11 criteria in the Diagnostic and Statistical Manual of Mental Disorders. It's 11 of them. And you apparently so, because it was 600 when you got. It was only 600 taps when you got on. I'm gonna eat me a sausage. I'm gonna eat me a sausage. I am. Why is it so many? Why it take 11 of them for them to see this person got a problem? I cooked nothing for breakfast. I got up and swept my room, made up my bed, bathed, washed my face, did my skincare routine, and honey, I started setting up to steady because I started my application for the test. Sure can't play no more. I got to steady. I started the application process to take AANP. But then I want to go back and do AANC, whatever. If I want to go into academia. But I mean, I'm pretty sure I can do it without it. So thank you. I just take my chances with this. I'm not gonna memorize 11 criteria for smoking. The hell I look like the Rain Man. I'm not gonna remember all that shit. The nurse practitioner is seeing a 58-year-old patient in the clinic who presents with unexplained weight loss, restlessness, and rapid speech. The patient's spouse, who accompanies them, shares concerns. Peaches, you back? She done peeing her. Weight loss, restlessness, and rapid speech. The patient's spouse who accompanies them shares concerns about the patient's mood swings, frequent nosebleeds. The patient appears fidgety and mentions recent financial difficulties. Given these findings, which screening tool would be the most appropriate to further evaluate this patient's condition? Mood swings, nosebleeds, financial problems. It's giving cocaine. Can I say that? The patient presents with signs that may be indicative of substance use, including unexplained weight loss. Because why you losing all that weight? You restless, mood swings, frequent nosebleeds. You know what that is. Yep. And financial difficulties. They definitely own that powder. They own that powder. Coke is the word. I'm sorry. That person is definitely on that powder. Hate to be the one to say it. Somebody got to. I really wish Felicia could learn how to give a gift, because what the hey, Felicia? What the hey? Oh yeah, because they finna have a heart attack. Because they definitely finna have a heart attack. You lying. If you didn't want to send me no gift, that's all you had to say. It's not a requirement. What they say, we appreciate the kind that folds. No. We appreciate the kind that jingles, but we rather have the kind that folds. And OJ didn't do it. A 34-year-old patient with bipolar 1 disorder presents for a routine wellness visit. The patient is stable and has been receiving pharmacologic treatment for the disorder for several years. Which of the following medications will the nurse practitioner mostly See, that's why I don't even trust Lee, because when they start having little mishaps like this, which of the following medications will the nurse practitioner which of the following medications will the nurse practitioner mostly likely see in a medication review? What in the world? It's funny how everybody can send gifts but you. That's the joke. That's the gag. I ain't fooling with y'all right now. I'm being professional. I'm being professional right now. I am studying. Christina had me showing out like that on that live. I was happy. I'm genuinely happy for Tina. But what did she go and say? That's what you're supposed to do. So just because you went to that school yesterday, honey, I need you to get on this phone and start tapping. That was yesterday. She ain't got to do it right now because we're gonna do the crunk. Tell Kim we're gonna do the crunk session around by 8. Because what's today? Thursday. I'm gonna come set up at your house on weekend. No, what? No, we're not gonna turn our relationship into me going live. No, she wasn't. Oh, I'm so sorry. Oh, I'm sorry. Hey, Quenisha got the pen. Let me see. Quenisha, we gonna get crunk later. We are. But y'all, somebody need to be on the YouTube because it don't be never be nobody on my YouTube. And Derry be swearing, I don't be getting my text messages. Well, how you get the call? Yeah, took that baby. I ain't gonna do that tonight though. I ain't gonna do that. It was just us girls in the live. So you can do a little, you know what I'm saying, a little shimmy, a little jiggle jiggle, a little wiggle wiggle. Your husband know his wife a liar. And apparently don't want to spend 29 cents on me. That's a lie because the nails I have on now that I am working diligently to remove, I have them because you paid for them. That was so sweet. That was a nice graduation gift. And I don't know why I won't let you buy gifts. Christina is asleep room. Oh, okay. Oh, y'all on the road? Oh, y'all be safe on the road. Oh my goodness, y'all are a traveling bunch. Be so happy to see y'all. What y'all eating today? Mhm. I know y'all eat something. I know y'all didn't get on that road home. Y'all probably had French toast, turkey bacon, pork bacon, hogs, sausage. You trying to spend more than 29 cents. You know what, Quenisha? Damn it. I'm tired of the lies. Now, I was going to leave it alone, and you done brought it back up. Anywho, maybe Grace, hello. But yeah, so I know y'all ate. What y'all ate? And I know y'all had something hot. Lithium is a mood stabilizer commonly used to treat bipolar 1 disorder, and it helps prevent both depressive and manic episodes. You gotta use. I ain't finna remember all that stuff for lithium. I mean, for bipolar. Bipolar equals lithium. Oh, we didn't have nothing. Just some pancakes, eggs, cheese, grits, sausage, and bacon, and orange juice, and cranberry juice, water, and milk, and some grape juice. I know y'all, and I know that refrigerator. Hey, Alpha Mode. Of course, I'll shoot you a follow if you start tapping that screen. Tap. You ain't playing. You cooked all that food. You probably you slept in because y'all been traveling a lot. Y'all have been on it, honey. You gotta tap some more. You gotta tap some more. Let me see. I can follow you from here, right? Oh, there you go. There you go, Alpha Mode. So make sure you follow, share, repost, and I'll do the same. Um, you got Alpha, you gotta tap like you mean it now. You gotta tap like you mean it. You got to set a little timer. Okay. Do I need to play the wait, Kanish, I might need to play the sound real quick for Alpha. So people know. Where is it? Here it goes. This is it. This it right here. Alpha, give me a second. Cause you hear you gonna work.
Tap in. That's not your net, nigga. Tap in. Tap in.
Oh my god, this isn't the clean version. Oh my god. That's okay. We here now. Quenisha. Mind you, I'm steadying. You better tap in. You better laugh at them taps. Okay. I'm steadying, Alpha. Oh my goodness. All right, let's just start over. I see it's at 2.6. Before you leave this live, Alpha, I want to be at 3. Is that a lot? I didn't even tell BC I have a TikTok. I think I told all of Facebook I have a TikTok. Yeah, so I don't know. I don't know about that. Thank you, Alpha. Have a good day. So lithium is a mood stabilizer commonly used to treat bipolar 1. It's first line. Why didn't it say first line for bipolar? And then alprazolam is used for anxiety disorder. I hate even putting stuff like that. I really just want to know first lines. And if that one don't work, a second line, but that's it. I don't want to confuse myself. Daria! You gotta get through the album. Where is it?
No, face that ass bitch. Tap in. Tap in. Diamonds dancing on your neck, nigga. Tap in.
Come on, Daria.
Tap in.
I'm steadying. I'm steadying.
Tap in.
Come on, we soup. I mean, I like the stack habit. Yeah. Okay, so yeah, there since I'm studying, it's a good way to go ahead and continue streaming, right? So you get longer hours. But I do need to post more reels because I don't even think live hours go towards your viewing hours, however it works. But if I'm going to go live, I might as well do both at once. So that's what I've been doing. And since I'm studying, I won't be getting off anytime soon. I am gonna take a break and probably post some reels that I already have to YouTube, but I'm trying not to post nothing since that barbecue video went viral. I think it's at 100K on YouTube and still at like 210 on Instagram. So yeah. No, I guess I am a nursing student. I'm not a generic nursing student. Yes, there, I think I saw you, but I appreciate you. And y'all gonna have to go and like those YouTube videos. So I guess the main three, they said Facebook pay good too. I really appreciate y'all. I guess I would say TikTok, Facebook, Instagram, and YouTube. Top three would be TikTok and YouTube. Paying attention to those. But it's hard not to want to repost and push those videos that are already doing well. So what I start doing is if a video is doing well, I just go ahead and send it to y'all. So like you ain't worried about trying to go and keep up. Cause I know Quenisha, she goes and tries to like dedicate time every day to like and share and do all the things. So I really do appreciate that. It's really y'all are a great support system. Hey Kendall. So yeah, doing that. So a 28-year-old patient who is a military veteran presents with a 6-month history of intrusive flashbacks of combat experiences. Oh, Darius, you starting to get badges too, Darius. Um, if you just came in, don't forget to collect your daily at the top up here. So don't forget to collect your daily. Look at, I gotta start doing it like that. Look at that finger. It's coming for you. It's coming for you. Look, look, look. So 4K. Oh my goodness. Welcome. And you got, oh, Quenisha, pin a comment. Welcome, tap, follow. Because we follow back. We follow back. That'll get them and keep them in here. They better learn something. A 28-year-old male patient who is a military veteran presents with a 6-month history of intrusive flashback of combat experiences, avoidance behaviors such as refusing to watch war-related movies, heightened irritability, and difficulty sleeping. He reports increased alcohol use to help him relax, but now seeks treatment. Which of the following medications is considered the first line for this patient's symptoms? So my boy has PTSD. We're gonna give him some Zoloft. Okay. Okay. The patient presents with symptoms of PTSD. Zoloft is a SSRI, and SSRIs are considered first line pharmacotherapy for PTSD. I can't see the pen comment on me. So, and Derry, did you see where I was adding the information in the chat? While I'm putting my notes into the chat on the YouTube. They don't they took your rights away. You still on there? Look, let's see now. What did I ask you there? I was asking you, did you see my I was putting notes into the chat on YouTube. Did you see it? Hey, Ray Ray. I can't see your name, but I'll follow you. I gotta delete something. You just need to know that's an SSRI. Serotonin. I don't know. Hey, Mike, tap in. How are you? I'm just studying for board. I don't know why it's not late to try again. I don't know. Maybe exit the live and come back. That may help. So I'm not sure. Did you see the comments on YouTube, Daria? Zoloft is a selective serotonin reuptake inhibitor. Zoloft for PTSD. Oh, and repost as well, because reposting TikTok will keep pushing it out. I think that's what the other ladies say. An 82-year-old patient presents with their adult child for routine checkup. The patient adult child expresses concern about their parents' increasingly forgetful behavior over the past 6 months, including misplacing items, forgetting appointments, and occasionally getting lost while driving. Taking keys. What is the nurse practitioner's next action? We're going to do an MMSE. We're going to conduct a cognitive screening, which is a appropriate first step in assessing the patient's cognitive function. Yeah, I like that. Late at night when all the world is sleeping, I stay up and think. Oh, Derek, get your daily. That's what you were talking about. Your daily is up by my name. Up here. You got to press the heart right there on your screen. That somewhere you are thinking of me too. 'Cause I'm dreaming of you tonight till tomorrow. I'll be holding tight. A 22-year-old male patient is brought to the primary care clinic by his brother. The patient has been experiencing auditory hallucinations and delusional beliefs for the past year. He's schizophrenic. He often hears voices criticizing his actions. His brother reports that the patient has been reluctant to take medication for his symptoms due to concern about side effects. Which of the following medications is most appropriate to initiate as a first line for this patient, especially considering his concern about side effects? So he's having those. No. Just, I see that. Don't do that. Don't do that. Um, he is having other. We're gonna put him on Risperdal, but what are those side? What are those side effects called, Quenisha? The hallucinations with schizophrenia. What are they called? It just has that weight gain, doesn't it? It causes weight gain. Is one of y'all on the YouTube? Yes, please share a tip for passing. That's why I should have put on here. Share a tip for passing. I'll be done with psych soon. I think I only have like 7 more questions. Dang, clozaril causes. With clozaril, you need blood monitoring because it causes a decrease in white blood cells. We need those, baby. No, just those type of side effects, period. It's not magical. It's positive side effects. I think it's like positive or symptoms, not side effects. I'm sorry. Symptoms. Yes, it's positive symptoms versus negative symptoms. Positive symptoms include distortions of normal functions, including hallucinations, delusions, disorganized thinking. Nothing. I figured it out. I'm sorry. I was asking like I was thinking out loud. That can be kind of confusing. Which of the following is the first line pharmacological treatment for major depressive disorder? A major depressive disorder in adults. It's going to be fluoxetine and SSRI. That's okay. Me either. I I thought about it. It's because I thought it was a weird name for it. But I don't need me a sausage. It's 1 o'clock. It's time to eat. I need me a sausage. I've been on YouTube for 3 hours. No, 2.5 hours almost. How the stewed chicken that you cooked yesterday? Why you on my live? You need to be on live cooking. Shoot. Was it good? I like some stewed chicken and rice. Oh, I ain't had a yellow rice in a long time because that yellow rice addictive. I'm trying to lose some weight. Okay. Gary, definitely YouTube. She had one up yesterday. I don't think I sent it to you. But she had one up yesterday and deleted it because she was scared. But she should have kept it up there. She surely should have kept it up there. I'm gonna see. Yeah, we know. Um, I'll send you one of Daddy to get your stuff going. Hello, Grace. Uh-huh. Gotta get it going.
We understand something. When y'all get breast milk from another mother, how do you know it's safe for your baby? Help me understand something. When y'all get breast milk from another mother, how do you know it's safe for your baby? Help me understand something.
I feel bad. Okay. My bad, Miss Darius. My bad, Miss Darius. Okay, fluoxetine. So fluoxetine. Let me go. You can put however you want to put it on there. You want me to just send it to you directly? So you can upload it from your phone? There, it don't matter. It gives you the option when you edit in the video to do a voiceover. But there, yeah, I'll send it to you. Put it on yours. And post it the same exact way I have mine because there are billions of people in this world. It's enough. It's enough people for the both of us. Okay. Which and then your following is gonna be a little different from mine because my demographic was moms. I was my account was being pushed out to moms and parents. You see what I'm saying? So post it. If I can get a video like a good video of mama cooking, don't be surprised if mama have on lipstick. Probably gonna put on a whole line just like I do most days. But I send that to you too. Because that's not my demographic. Not saying I won't get anything off of it, but it ain't Ruby White trying to be funny. She wear burgundy wine. trying to be funny. Fluoxetine. It's an SSRI and it's considered first line pharmacological treatment for major depressive disorder in adults. A CCO mama color called what's that wine grandma used to drink? That's what my color my mama's is. A 68-year-old patient presents with their partner who expresses concerns that the patient's memory has started showing some signs of impairment. The patient has been more forgetful, frequently losing items and being unable to recall some conversations. Which of the following screening tools is most appropriate for the nurse practitioner to use based on this complaint? I don't know. Ain't that part of it? The Montreal cognitive, the mocha. The clock drawing test is a part of the I mean, it's MSC. MSC. I'm kind of confusing. But you know what? If MMSE isn't up there, I'll put the mocha. Don't worry, Quenisha, I got it. I'll send it to you. Because folks be playing, be acting scary and stuff. Huh? Here you go, Quenisha. Um, yeah, we at 9K almost. Quenisha, I sent it to you. I sent it. Whew. Exhaustion. Um, Okay. Okay, 9K. Okay, so you just need to come out of the live and come back. That's why it wasn't letting you pin. Okay. Oh, that's why you would get that. Right. It this was created by the mocha was developed by a Canadian. I may have just lied because am I? Oh, I ain't playing. A 40-year-old patient complains of difficulty falling asleep and staying asleep for the past month. They deny any recent major life stressors or changes. They drink 1 cup of coffee in the morning and do not smoke or consume alcohol. They report feeling tired during the day. What would be the most appropriate next step in assessing the patient? He has a cup of coffee. I need to know about the sleep routines and habits, right? Why would I click on it and don't go ahead and tell me? We need to ask about the patient's bedtime routines and sleeping environment. I would jump straight to a polysomnography because the patient, I guess if I examine the patient and mirtazapine, and they say, "Oh yeah, I wake up coughing," then I think, yeah, you need to sleep steady. You probably holding your breath and having periods of apnea while you're sleeping. A 30-year-old patient presents with complaints of recurrent abdominal pain and diarrhea. He has been to several providers over the last year and has undergone numerous tests, all of which came back normal. Despite receiving medical clearance multiple times, he insists that his symptoms are real and severe. He has an extensive medical history with frequent hospitalizations, but no clear diagnosis has been established. It is. The camera bad on this too, but I can't go live on my iPad or my phone yet, and I don't know why. The assessment finds that would most strongly support the nurse practitioner's suspicion of factitious disorder imposed on self is that the patient becomes defensive and demands more tests when asked about inconsistencies in his history. That's a tricky one. 10K, woo! Oh my gosh. And now we're almost at 11. Oh, there's a restriction on. Let's see. It says something about body exposure, but I didn't do anything. I don't know. Maybe it was talking about my thighs. My thighs were showing for a second. I don't know. A 22-year-old female presents to the clinic accompanied by her parents. The parent expresses concern about their daughter's recent behavior. They report that over the past 6 months, the patient has become socially isolated, often talks to herself, and believes that the television is sending her secret messages. The patient insists that her neighbors are conspiring against her. She has no history of substance misuse, and there is no known family history of psychiatric disorders. Which of the following assessment findings would be most indicative of a diagnosis of schizophrenia in the patient? Girl, auditory hallucinations instructing the patient to harm herself. Didn't nobody tell you to do that. It says the videos are unavailable. Been lying all day. Oh yeah, the video is unavailable, Quenisha. I'm sorry, you ain't lying about that. Let me see, because I follow her. She ain't got to send it, Quenisha. Don't you worry about it. I gotta figure out how to do it while I'm lying. Well, I hope somebody fix me a sausage. Ask Muffin fix me a sandwich, child. Muffin, I'm in the mood. Can you fix me a sandwich on sourdough? You don't have to toast it. Caesar dressing. No, maybe not. Yeah, a sandwich would be fine. I think we're out of lettuce, so you can't put lettuce on it. And the tomatoes are going bad. I guess just a sandwich, child. With about 4 or 5 pieces of meat on it because it's small, thin slice. And a body armor, please. Um, I don't know what I'm gonna do for my YouTube channel now that barbecue video up there. Like, I don't even know because that's gonna change. Let me pay attention. Let me finish this. I'm almost done. A 26-year-old patient in the second trimester of pregnancy presents with complaints of feeling down for the past month. The patient states that they have difficulty sleeping and sometimes wakes up in the middle of the night with anxious thoughts. They feel constantly fatigued, has diminished appetite, and expresses guilt over not feeling as connected to their unborn fetus as they believe they should be. The patient denies any thoughts of self-harm or harm to the fetus. They have no history of depression. And oh, it's a pretty. And their pregnancy has been uneventful so far. What is the most appropriate initial step in management of this patient? I don't know. I mean, what is this on YouTube? Okay. Anywho, I almost said a bad word. That hurt my nails so bad. They so flimsy. Let me clip that. Cause yeah, we not doing that. So, oh my gosh. It'll take 2 years. I've been waiting 85 years. Um, a 30-year-old patient. Wait, no. I thought I did. I'm sorry. Administer the Edinburgh postnatal depression scale to better assess the severity of the patient's symptoms described by the patient. Feelings of guilt, disturbed sleep, fatigue, and decreased appetite can be suggestive of depression in pregnancy. Well, maybe it shouldn't be called postnatal. But hey, you. I try not to show what I feel about you. Oh shoot. Oh man. I see. How Scarlet? Am I frozen? Don't ask me about a patient case. Despite what that says, do not ask me about a patient case because mm-mm. um last question on site. A 30-year-old patient presents for a 6-week postpartum checkup and expresses feelings of fatigue, overwhelmed sadness, and difficulty bonding with the newborn. Just share your page, the little arrow, the hooked arrow, and difficulty bonding with the newborn. The nurse practitioner is concerned about the possibility of postpartum depression. Which of the following factors in the patient's medical history would significantly increase their risk for developing postpartum depression? Prior history of major depressive episodes, previous C-section due to breech presentation, second degree perineal tear during delivery, history of gestational diabetes with controlled diet. Depression. I mean, I made a 91 out of 53 questions. That's decent. That's decent. Mm. Oh, thank you, Darren. Hey, Peaches. So let's look at. Let's review this one. Next, I just did psych. Because I sure been wanting to take some green. On my YouTube, because my feet will do stuff like that. 2 o'clock. I'm glad y'all all in here. Because, Peach, what you got for lunch? It don't matter. Y'all know what time it is? It's lunchtime. Did you fix a sandwich? Tap. You need to tap. Why you done snuck in here? So embarrassing, y'all. Don't at her. She need to at my sandwich. I asked for a sandwich for lunch. For my lunchtime studying. I don't have anything to say. Fifi ain't did nothing. Fifi's so disrespectful. It don't make no sense. Fifi is disrespectful. No respect. Oh shit. I didn't do that. Hello. I believe it. I believe it works. We should have been at 30K likes by now. I'm teaching, I'm learning. So chronic alcohol use commonly results in macrocytosis, which is an increased MTV due to folate deficiency, and thrombocytopenia due to bone marrow suppression and impaired platelet production. So low platelets. Dang. That's sad. You cannot drink beer on Nardil because it is an MAOI and you will throw yourself into a hypertensive emergency and possibly stroke and possibly have a stroke. So I don't think you can have guacamole with MAOIs either. Um, Yeast and what? What did I say about yeast? What was I saying? I'm sorry. Oh, with the MAOIs? No, it's a tyramine in the beer. The tyramine is contraindicated with the MAOI, but MAOIs, those, if you don't put somebody on something, I don't think. Well, you know what? I mean, I guess as the primary care provider, I have to be aware of what my patient is on, because if I'm since I'll be prescribing, but yeah, it's a tyramine. I'm trying to just go back. Oh, I'm not even worrying about that. I'm not gonna know all 11 criteria for smoking something. Oh, okay. We finished psych. Yay. What should we do next? I did psych. Am I gonna do head to toe? Because if I'm gonna do that, I might as well go ahead and go to I might as well go to neuro. Might as well go to neuro. Where that little girl go? I don't know what Daria did, but Daria is the top viewer. And then Peachy. Oh, 18K. Wow. You girls must really like me. So I guess I'll do the nervous system next. Even though somebody said that leak didn't really help them, this is what I have. I'm scared to take no free practice test, girl. They may not be, you know. Oh, you tap, 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 then. Oh, I do have that. While you tapping, where is my sandwich? I know I got that on my phone. Yeah, put some of them veggie chips on there, please. I'm trying to log into FNP Mastery because I feel like I know a lot of these answers because we did so many during school. I need questions like what's going to be on the test. $20K. Oh my goodness, that is amazing, ladies. I'm trying to get the oh. Because you only have to like the YouTube once. Just FYI. I appreciate it though. Sure do. I have to travel. It's okay though. Well, no, there is one. I think I actually said too. You don't have to I said you don't have to keep Stephanie. Maybe an hour. It ain't bad. Long enough for me to listen to a podcast. It's not far. I'm sorry, I'm just showing up my business. I can't use Tide, make me itchy. Tide makes me itchy. Oh, 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 oh. Go lover. Don't you dare slow down. Oh lover, you can last for rounds. Push harder. We almost there now. Uh-oh. I play too much. Let me just sign up for this again and do a free trial. I want to see it. Hey Meg, Quenisha Meg is in. Meg will follow you. Remember to tap in and don't forget to get your daily from up here. Turner. I asked her to fix that sandwich. Girl, please. And Caesar, I don't do mayo. Caesar dressing, no mayo. You have. I think you can. You should be able to add her. Oh, I don't know if Meg is. Oh yeah, Meg is a girl. There you go, Meg. Meg, don't forget to tap in and get your daily. I think TikTok flagged me because my thighs showed for a second. Trying to see. Did Meg? Let me see. Is Meg still here? Hmm. Only get 3 days free. Oh. This is Lyme disease, y'all. You treat it with doxycycline. Still ain't got my sandwich. I didn't think it was Rocky Mountain spotted fever. They didn't describe it. Um, Turkey. It's a turkey one. Mm. So I gotta pay attention to where it is. Northeastern states. Know how to treat it, but sometimes okay, so the key point of this question is the geographic location. So Lyme disease is more so in the northeastern US, north central states, and parts of the west coast. So if you Lyme, you up north. That didn't make no sense. That didn't make no sense. An adult patient with a history of heart failure is diagnosed with community acquired pneumonia, which is the most appropriate treatment. Community acquired. Ah, Levaquin. Oh, because they have heart failure. So without comorbidities, you would do amoxicillin. Did you cut it in half? It's okay. You can bend them on. I cut my sandwiches in half. And then on a knife, I cut. This is lunch. This is dinner. This is lunch. Forget it. You see me cut my sandwiches in half every day. Almost every day. I wanted some of those fresh tomatoes out of the garden, but have fun. This is sourdough bread. Not none of that cheap sunbeam shit y'all eat. I'm just playing. I got some of that too. Who what's the name? Get a taste, get a taste, get a taste. 25. Hey, who tapping? Y'all tapping behind my back. Thank you, baby. I just want to wipe my mouth with my hands. Mm. Thank you. Get a taste, get a taste, get a taste. Look, I don't use mayo. I use Caesar dressing. And I typically have lettuce and tomatoes, but I cook tacos, so ain't no more lettuce. I should put my lettuce up. And the tomatoes are too ripe. Are they soft? They're good. I mean, mm. Here's the taste. YouTube for 3 hours. I've been studying. Uh-oh. This is turkey. Pepper that paper out that cup right there. I don't buy that hog. Now why you say that? No, I ain't. You know how you trying to be funny? It's a whole nother half. You know, y'all like coming on here and publicly bashing me and shaming me. But nothing wrong. You know who put them on? Who told me about them? Dairy fat ass told me about you. They're $1.75. The small bag is $1.75. Oh, I thought you said 2 for 3. Where? Look, I bought 3 packs last night. I got 4 for 6. Oh my goodness. Everywhere. No, that's a lot. Dollar General, maybe you pay $1.65. Well, how the hell you know? I don't like being body shamed, so let me slow down before I eat my sandwich too fast. Yeah, somebody gonna ask me earlier, why are you on live at work? Are you a nurse? That's what I tell you. Get the hell off my page. I said, if you minding my business, who minding yours? Most importantly. But anyway. Sean's videos are good. Sean like Lee when it comes to his videos. And I gotta do better. I'm gonna post something good today. While I'm on my study break, my only did one subject. But I'm studying all day. Well, make sure you like, posting, and reach and sharing. I mean, your husband like whiskey. Make sure he follows Sean. Cause I can't do nothing right over here. I'm glad you enjoy Sean's videos so much. You got any suggestions? These people tired of looking at me talk in them tight scrub top. I gotta get more creative. I had multiple people tell me you gotta jump on every trend. You're not gonna have me look like no fool. You ain't a plum fool if I go buy a hat to put on. The people want movement. Well, thank you, Felicia. That makes me feel good. Mm-hmm. Yep. Can I start eating the second half of my sandwich now? I know you did because you called me fat. You trying to call me fat. No more bandanas. That was baby session. I don't even wear my bandana when I'm doing videos. Thank you for telling me how you feel. And bandanas are back in. I wear my bandana to the gym. It helps with the sweat. I did pray a little late for my sandwich. Lord, forgive me. You know I love a sandwich. Oh my goodness, I love it. Y'all done told this man I'd take him to the rental car place. The syrup lady. Pearl. And so what you gonna say, cause the Pearl? What should I say, slave like? Don't try to change the subject. What you talking about Pearl? See, that's that colorism. I know who Pearl Millen is. That's that colorism. So what it look like when you wear a bandana? With your fair complexion. What it look like when you wear a bandana? Maid? Is that what it look like? So it's different when I wear a bandana, kind of dark skin. Oh, so you wear the bun and make you French. Creole. Me wearing a bandana make me a slave. I ain't saying I ain't saying where I come from. I'm not ashamed. Uh-oh. Is anything unsold yet? And some things don't have to be said. And you know what? When people start throwing colorism jokes and slurs of racial, it's time to end the line. I gotta make a video because apparently Sean video good and mine ain't. So apparently I need to work on my video. I hope I can get something done 'cause I ain't got no medical equipment in my office. Yeah, I'm sorry, baby. I'm in there checking for you. You might have to cancel that order because your stuff ain't here. Or maybe you can get Will on there so I can get 30,000 taps. I bet you laugh. I bet it's so funny. I bet it's so. I bet everything is so funny and soft when you light skin. I bet the world is just flowers and opportunities when you high yellow. But you know what? What's left for me? What's left for me? That's what's left for me. All that's left in your wages. You want that's how you want my videos to be. You want me to dance for you? You want me to entertain you? Bad word. What you want me to do? That's what she want me to do. She want me to dance, make fool with myself in my videos. Oh, Sean video is so good. Oh my goodness, Sean make the best whiskey videos, Deandra videos. All she do is talking to the camera and give us evidence-based information. ACOG information. Oh, fine. Bye. I guess we can have a tap round. Somebody in here, Quenisha, and I don't think they're tapping because it's at 28K. It hasn't changed. I definitely like the sourdough bread toasted better. Where is it? Bring here. Another iPhone 2. Bring here. I gotta help. Quenisha! Oh, Gentle Hands Home Care. Welcome. We're just being silly. I'm on my study break. I'm studying for my FNP boards, the AANP. I'm taking a mental break right now before I start again on neuro or the nervous system. See, that sandwich is probably about 300 calories, so that's not going to throw me off of my weight loss goals. Come here. Let me show you how I was done. Big eyes. Y'all watch me work. Oh, I'm frozen. Okay. I hate you didn't hear everything I said because I made some points for you and your light skin. Okay, we are ending the live. When we hit 30K people, we are at 29.8. We are at 29.8. We are at 29 point. Oh, we're at 30. Cause see, I know how to tap. I don't know what y'all be doing. I know how to tap. I know how to tap. You see, you got to tap like this. You see that? Tap like that. You got to tap like you playing at Nintendo from back in the day. Okay, y'all. I appreciate y'all. Y'all are the best. Y'all know that. Join us for the real live tonight. I'm not doing any more steady lives. I don't know. I might since I don't really have to engage with people. But thank you, Jesus. Thank y'all. He's the one to thank. He's the one to call. And just so you know, Quenisha, Jesus was probably dark skinned. Okay. All right. Thank y'all again. I appreciate y'all. I'm about to end the YouTube stream as well. Let me get my black butt off of here. Thank you, Darian. You using one finger. You got to, once you feel that vibration hit, you got to, like that, like that. That's why we could have been at 60. We could have been at 60. Syria, when you go live, I'm gonna show you how it's done, baby. I'm gonna show you. I'm gonna have you at 100K likes. I'm gonna have everybody tapping. But thank y'all. Okay, I'm gone. I gotta make a video. But, well, actually, I gotta run an errand and then I'll make a video. Okay, guys, love y'all. I was tapping. I didn't get any money. I got you 1,000. I believe it because it went up. Thank you, baby. Yeah. Told you I know how to tap. I was using my 2 fingers. That's how you're supposed to do it. I don't know what they were doing. They're talking about, dang, I was using 1 finger. And that's why we where we are. I was using my thumb. Oh, shoot, I forgot I was still on YouTube. Mom, you gotta use the thumb. Oh, how long it took you to get to 1,000? Oh,
I was typing every time I typed, I got 400 something. I got like 100 something the first time, and then I got 439, and then 439.
very good, man.
And then I got to make a sandwich.
Thank you. I think I can end the live at 3 hours and 30 minutes. But found out today that your live minutes don't count towards your minute.
You check real quick.
Mm-hmm.
I saw something.
But you need to go check the mail.
I don't know if it was a real bad or not.
Or you might as well just order it again, and you also cancel that, request a refund, and then order it again, and through or, find some other ones and order. Because it looks like the storm is making it take longer, way longer than expected. So that's what I would do.
But
I gotta get up.
you can help them.
I'm gonna do a final something. That's a possibility, though.
Okay.
Okay. Let's go into this.
The horse, just because you have a horse, you have a lot of but that's good feeling. Very much like it and how a lot of rope says, but in fact, on the ground, twice before mine, and not hats. It's exactly something. They're black before I. Okay, black. You saw speaker. I suppose. No, as a unified clause, man, and analyze structured and unstructured logic across your application using proprietary SDKs or vector tools required speech plus. You can also severity.
Really good videos. I would want those in mine.
AI can also analyze the logs very dynamically. Like it suggests next step by reading logs together with your errors and analytics. Helps teams faster, understand the root causes, and stay more reliable content. So, we like to say your final destination is logs. Ending. Oh, well, I guess you're still in a green permission. Well, fair. It isn't reforms. But with emphasis, people with moderate to severe eczema can have uneven results. like skin that's still more clear at 1 year. Tell you if you're allergic to Atlas.
What can they use to warm their breasts? I didn't get up. I'm having too many.
Ask your doctor about what's good for you.
I need to give them the milk storage during the storm. Post that as a reel.
Right? You know, it's my dream. Absolutely.
And it's a show thing. Do I have an infographic? There you go. Okay. We will reconvene later.